Hi, I'm Caitlin Harold, and this is my Language of Anatomy lab video. So first we'll start off with the body regions and their anatomical terminology. So first on the list is the hallux, or the big toe. Then we have the axillary, or the armpit. Next is the buccal, or the cheek. Then we have the pollex, which can be found right here, also known as the thumb. Next is the patellar, or the front of the knee. Then we have oral, also known as the mouth. Next is mental, the chin. Then we have the brachial, or the upper arm. Next is the antebrachial, or lower arm. Then we have the crural, or the leg, the umbilical, or the navel, which can be found right here. Then we have the femoral, or the thigh. Next is the calcaneal. Let me lift my buddy up really fast. The calcaneal, or the heel. Then we have the sural, or the calf. Next is the popliteal, or the back of the knee. Then we have the olecranon, which is the back of the elbow. Then next we have the acromial, which is the point of the shoulder. And then last is the occipital, or the back of the head. So now we'll go over the directional terms. So first, to demonstrate, is that the head is superior or higher than the sternum. Then next we have the olecranon, which is the back of the elbow. And it's distal, or further away from where the appendage attaches to the body, than the acromion, or the point of the shoulder. Next, we have the axilla, which is the armpit, and it's proximal to the brachium, or the upper arm, which means that it's closer to where the appendage attaches to the body than the upper arm. Next, we have the nose, which is medial to the eyes, which means that it's closer towards the center of the body than the eyes are. Next, we have the elbow, which is proximal to the carpus, or the wrist, which means that the elbow is closer to where the appendage attaches to the body than the wrist is. Next is the sternum, which is anterior to the vertebral column, which means that it's closer towards the front of the body. You can also say that the vertebral column is deep compared to the sternum. Next, we have the umbilicus, which would be right here, and it's inferior to the sternum, which means it's closer towards the feet, the bottom of the body, than the sternum. Next, we have the patella, or the knee, which is proximal to the tarsus, or the ankle, which means the knee is closer towards the top of the appendage as compared to the tarsus, or the ankle. And then lastly, for directional terms, we have the ears, which are lateral to the nose, which means that the ears are towards the outside of the body as compared to the nose. So now I'm going to go over the abdominopelvic regions. And the first one is the right hypochondriac, where you can find parts of the liver and the gallbladder. Next is the epigastric, where the majority of the stomach is, as well as parts of the liver. Then we have the left hypochondriac, and that's where you can find the spleen and the pancreas. Next is the right lumbar, and that's where you can find the ascending colon of the large intestine. Next is the umbilical, where you can find the transverse colon, parts of the small intestine, as well as the bifurcation of the aorta. Next is the left lumbar, and that's where you can find the descending colon of the large intestine, as well as other parts of the small intestine. Next is the right iliac, and that's where you can find the cecum and the appendix. The 8th region is the hypogastric or the pubic region, and that's where you can find the urinary bladder, parts of the small intestine, as well as some of the female reproductive organs such as the ovaries or the uterus. And then lastly, we have the left iliac, and that's where you can find the initial part of the sigmoid colon as well as the descending colon.